37-year-old Rachel Smith and her husband have been trying to start a family for the past 5 years.
We decided to turn to IVF after the 2 miscarriages. It is an absolute emotional roller coaster. And one day you go into the fertility specialist and everything is looking good, to then like maybe 3 or 4 days later, you come back and you're just bawling, crying.
The Florida couple, both on active duty in the military, doesn't have fertility coverage through their jobs. She says they've paid about $60,000 out of pocket for IVF and fertility care.
There is a lot of uncertainty already when you're trying to have a baby. How stressful is the financial component of it, Rachel?
It is very stressful. We've done 5 rounds of IVF.
When couples first start out, they aren't sure how much they're going to be on the hook for, right?
I had no idea that IVF was going to be that expensive. So that was obviously money that we had put aside for our savings.
Nearly 100,000 babies are born with the help of IVF each year. It's a process that can cost $20,000 to $30,000 per cycle. A cycle starts with 2 weeks of hormone injections for the mother, followed by egg retrieval. Viable eggs are fertilized into embryos, and usually one is transferred in hopes of a successful pregnancy. It can take multiple rounds to have a baby, and the odds get worse with age.
I was one of those patients that took 6 cycles to conceive.
Founder and CEO of Future Family, Claire Tompkins, experienced it firsthand 10 years ago before having her daughter, Natalie, and then twins, Lucas and Audrey. So she started a company to help families finance the cost of IVF. This month, they're launching a first-of-its-kind national insurance policy to cover IVF expenses.
The reality for many couples is if you're facing an expense that could be up to $40,000 or $50,000, being able to insure that expense gives you peace of mind and financial security.
How can people afford insurance on top of the already expensive IVF cycles?
Yeah, today insurance on average is about 20% the cost of coverage. So if you are insuring $40,000 of IVF expense, you might be paying up to $8,000.
It's not cheap, but Future Family gives couples the option to put down a small amount, then 6 months to pay the full premium. Tompkins says if a couple doesn't have success, meaning a live birth, after 2 cycles within a 30-month period, they can file a claim to cover the cost of what they paid, up to $50,000. There are several other programs that offer refunds for IVF when patients don't have success, though they can be limited to specific fertility clinics or only available in certain states. Experts say the insurance policy is a step toward helping families.
If it provides comfort to a patient, all the power to them. But it is important for people to be aware and not disappointed that they may not meet the eligibility criteria.
According to Resolve, the National Infertility Association, just 22 states plus D.C. have infertility insurance laws, including 15 plus D.C. that require coverage for IVF. Nationally, Dr. Lucky Seacon estimates only about 1 in 4 women going through IVF has coverage.
It's been viewed as this luxury that people can elect to do, whereas we fertility doctors know that infertility is a disease and fertility care is essential. It needs to be viewed essential just like pregnancy care.
Rachel Smith says she'd be interested in the insurance program because she's not giving up on her dream of starting a family.
There's going to be more rounds of IVF, to be honest, even if it takes, 10 rounds. I would love to have 2 or 3 children. I would like to, be a mom that's very involved in their lives.
And we wish them well. Now, this insurance, it is not available to everyone. Right now, in the first phase, women 38 and older who want to use their own eggs for IVF would not qualify for coverage. But just remember, states actually do have scholarships and grants. So talk to everyone all your healthcare providers, because there may be options available to you that you aren't aware of that could help pay for some of these costs.
Yeah, but the amount of hoops that you have to go through to sort of piece together all of these things to come up with the money, it just shows you this is not easy, but people want to get it done, obviously.
Important story, Vic. Thank you.
Thank you, Vicky.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.